Yeah. Yeah.
Hi everyone, in this video, we'll be discussing about dengue hemorrhagic fever. Dengue hemorrhagic fever is a fatal manifestation of dengue virus that manifests with bleeding, diastasis, and hypovolemic shock. These viruses are related to the virus that cause West Nile infection and yellow fever. It is caused by a etiologic agent and vector of dengue are called flavivirus and Aedes aegypti. Signs and symptoms, which usually begin 4 to 6 days after infection and may last up to 10 days. These include high fever. Sudden high fever occurs as a result of the infection. Severe headache. Severe headache also torments the patient. Damage to limb and blood vessels. As the virus is slowly spread, even the limb and blood vessels are affected. Bleeding. Bleeding from the nose and gums is a characteristic of VHF. Enlargement of the liver. The dengue virus could also penetrate the liver, causing fatal damage. And the last one is circulatory system failure. The circulatory system ultimately fails eventually in the disease if not treated promptly. Incubation period. It has an incubation period of 3 to 10 days after the bite from an infected mosquito. Pathogenesis. Pathogenesis. Several theories seek to explain the pathogenesis, including the selection pressure hypothesis. Claims that dengue virus varies and mutates as a result of selection pressure as it replicates in human and or mosquitoes, especially dengue-virus. Diagnostic findings are dengue virus isolation, immunoglobulin titers, complete blood count, and decreased platelet. These tests confirm dengue. Medical management. The medical management of DHF is actually simple as long as it is detected early. Oral rehydration therapy. Oral rehydration therapy is recommended for patients with moderate dehydration caused by high fever and vomiting. Blood transfusion and blood products. Patients with internal or gastrointestinal bleeding may require transfusion, and patients with coagulopathy may require fresh frozen plasma. Oral fluids. Increase in oral fluids is also helpful. Avoid aspirins. Aspirin can thin the blood. Nursing intervention. Nursing interventions appropriate for patients with DHF include blood pressure monitoring, maintain patency of vascular access for fluid administration or blood replacement as indicated, medicating regimen. There must be periodic review of the medication regimen of the client to identify medication that might exacerbate bleeding problem. Fluid replacement. Establish 24 hours fluid replacement needs. Managing nosebleed and position the patient into a Trendelenburg's position. That's all my topic. Thank you for watching and stay safe. Bye!
Assalamualaikum. I'm Rohalmina El Marjusi, BSN2 from Leininger. So for today, I'm going to explain the viral hepatitis. What is viral hepatitis? Viral hepatitis is an infection that causes liver inflammation and damage. Inflammation is swelling that occurs when the tissues of the body become injured or infected. Inflammation can damage organs. Researchers have discovered several different viruses and external link that cause hepatitis, including hepatitis A, B, C, D, and E. So, hepatitis A and hepatitis E typically spread through contact with food or water that has been contaminated by an infected person's stool. People may also get hepatitis E by eating undercooked pork, deer, or shellfish. Hepatitis B, hepatitis C, and hepatitis D spread through contact with an infected person's blood. Hepatitis B and D may also spread through contact with other body fluids. This contact can occur in many ways, including sharing drug needles or having unprotected sex. The hepatitis A and B and E viruses typically cause only acute or short-term infections. In an acute infection, your body is able to fight off the infection and the virus goes away. The hepatitis B, C, and D viruses can cause acute and chronic or long-lasting infections. Chronic hepatitis occurs when your body isn't able to fight off the hepatitis virus and the virus does not go away. Chronic hepatitis can lead to complications such as cirrhosis, liver fluid, and liver cancer, NIH external link. Every diagnosis and treatment of chronic hepatitis can prevent or lower your chances of developing these complications. When doctors can find the cause of a person's hepatitis, they may call this condition non-negative A, negative E hepatitis or hepatitis X. Experts think that unknown viruses other than hepatitis A, B, C, D, and E may cause some cases of hepatitis. That's all. Thank you.
Assalamualaikum warahmatullahi ta'ala wabarakatuh. I am Napta and Mandi from BSN2 Leininger. So my topic for today is typhoid fever. So what is typhoid fever? Typhoid fever, also known as enteric fever, is a potentially fatal multisystematic illness caused primarily by Salmonella enterica serotype type B and, to a lesser extent, S. enterica serotypes paratype B, A, B, and C. The terms typhoid and enteric fever are commonly used to describe both major serotypes. Causative agent of typhoid fever. Typhoid fever and paratyphoid fever are life-threatening illnesses caused by Salmonella serotype type B and Salmonella serotype paratype B, respectively. The signs and symptoms of typhoid fever are weakness, stomach pain, headache, diarrhea or constipation, cough, and loss of appetite. So the next one is incubation period. The incubation period of typhoid fever is typically 6 to 30 days and 1 to 10 days paratyphoid fever. Period of communicability. From 3 days to over 60 days, usual range is 8 to 14 days depending on inoculum size and on host factors. Period of communicability. Typhoid is communicable as long as S-type B is being excreted in stools or urine. Usually from 1 week after symptoms onset through convalescence and for a variable period thereafter. So the next one is pathogenesis of typhoid fever. Typhoid fever is an enteric fever characterized by systematic illness along with abdominal pain and fever in a step-ladder pattern. The organisms responsible for enteric fever is Salmonella type B. Other serotypes, Salmonella paratype B, A, B, and C, also cause similar syndromes but with less clinically significant disease. So diagnosis of typhoid fever. fever. A diagnosis of typhoid fever can usually be confirmed by analyzing samples of blood, poo, or pee. This will be examined under a microscope for the Salmonella typhi bacteria that cause the condition. The bacteria aren't always detected the first time, so you may need to have a series of tests. Medical management. Several types of antibiotics are used to treat typhoid fever. In many cases, typhoid fever is treated with ampicillin, chloramphenicol, or cotrimoxazole. However, doctors also use fluoroquinolones, including Cipro and Levaquin, cephalosporins, including cefepime and azithromycin. So the next one is nursing intervention. A complete nursing intervention of a person with fever needs to focus on 4 areas. Number 1 is decreased body heat production. Advise the person to take a complete rest to minimize unnecessary energy expenditure, which may increase body temperature. Anticipate the person's needs and keep things within reach to avoid activity on his part. Inform the person of his condition and treatment to reduce apprehension and anxiety. So number 2 is promote body heat loss. Dress the person with lightweight clothing. Keep the person cooling by providing a fan or nurse him in air conditioner room. Sponge the person with tepid water. Take a cool bath if necessary. Increase fluid intake if the person has no fluid restriction. Fluid can be the form of water, ice drinks, ice blocks, jelly, juices, or whatever he will drink. Number 3 is monitor and maintain body function. Take temperature reading every 4 to 6 hours. Pulse, respiration, and blood pressure should also be monitored in high fever, as these vital signs may indicate complications. An increased temperature is usually accompanied with increased respiration and heart rates. The person's behavioral changes should as confusion, restless, or disorientation should be noted in high fever. Check the state of hydration, since fever tends to be very debilitating and dehydrating. Learn more about dehydration in the topic day-to-day care. So observation is fluid balance. So fluid intakes should be increased to replace fluids lost through insensible water loss and sweating. The conclusion of soups are recommended because of their sodium content. So number 4 is promote comfort. Provide oral hygiene to keep the mouth and lips moist. If the person is lying on the bed, frequent changing of position and linen help to reduce discomfort. Frequent changing of clothes is also necessary because of increased sweating. Severe paracetamol such as Panadol if the person has headache. Use a lightweight blanket if the person feels cold or shivering. So that would be all, and thank you.
Assalamualaikum, I'm Sharmina in Mallah from PSN2 Leininger. In this video, I'm going to explain the leptospirosis. What is leptospirosis? Leptospirosis is a pathological bacterial infection which is basically transmitted by animals to humans. Leptospirosis is a bacterial disease that affects humans and animals. It is caused by bacteria of the genus Leptospira. In human, it causes a wide range of symptoms, some of which may be mistaken for other diseases. Some infected persons, however, may have no symptoms at all. Leptospirosis is a bacterial disease that affects humans and animals. It can pass from animals to humans when an unhealed break in the skin comes in contact with water or soil where animals' urine is present. Leptospirosis is caused by a bacterium called Leptospira interorgans. The organism carried by many animals and live in their kidneys. It ends up in soil and water through their urine. If person around soil of water where uninfected animals has feed, the germs can infect in body through breaks in the skin like scratches, open wound, or dry areas. Symptoms of leptospirosis usually appear suddenly about 5 to 14 days after infection. However, the incubation period can range from 2 to 30 days according to the CDC. Leptospirosis symptoms including fever, chills, headache, vomiting, loss of appetite, muscle strain, redness of the eye, and cough. There are two main types of leptospirosis, the mild leptospirosis and the severe leptospirosis. The mild leptospirosis, this accounts for 90% of cases. Symptoms include muscle pain, chills, and possibly a headache. Severe leptospirosis between 5 and 15% of cases can progress to severe leptospirosis. This organ failure, internal hemorrhaging, and death can result if the bacterium infects the liver, kidneys, and the other major organs. So, how does a person get leptospirosis? Human can become infected through contact with urine or other body fluids except saliva from infected animals. Contact with water, soil, or food contaminated with the urine of infected animals. That's all. Thank you.